Chlordiazepoxide-Clidinium is a combination of two drugs, clidinium and chlordiazepoxide. It is used with other medications to help treat stomach and intestinal disorders such as ulcers, irritable bowel syndrome, and bowel infections. Clidinium helps to reduce stomach and intestinal cramping by slowing the natural movements of the gut and relaxing the muscles in the stomach and intestines. This medication belongs to a class of drugs known as anticholinergics/antispasmodics. Chlordiazepoxide helps to reduce anxiety by acting on the brain and nerves to produce a calming effect. It belongs to a class of drugs known as benzodiazepines. It is important to take this medication as directed by your doctor and at the recommended dosage. It is best to take it at the same time each day to maintain a consistent level in your body. Before you start taking chlordiazepoxide-Clidinium, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 3 to 4 times a day, 30 to 60 minutes before meals and at bedtime. If you are taking an antacid, take it after meals and take this medication before meals. The dosage is based on your age, medical condition, and response to treatment. Older adults usually start with a lower dose to decrease the risk of side effects. Do not increase your dose or take this drug more often without your doctor's approval. When this medication is used for a long time, it may not work as well. Your doctor may need to increase your dose or change your medication. Talk with your doctor if this medication stops working well. Though it helps many people, this medication may sometimes cause addiction. Take this medication exactly as prescribed to lower the risk of addiction. Tell your doctor if your condition lasts or gets worse. Some of the common side effects of chlordiazepoxide-Clidinium include dizziness, drowsiness, weakness, blurred vision, dry eyes, dry mouth, nausea, constipation, and abdominal bloating. If you experience any of these effects, it's important to consult your doctor or pharmacist. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. For dry eyes, consult your pharmacist for artificial tears or other eye lubricants. To prevent constipation, it's recommended to eat dietary fiber, drink enough water, and exercise, and you may also need to take a laxative. It's important to remember that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. However, it's important to tell your doctor right away if you experience any serious side effects such as decreased sweating, fast/irregular heartbeat, trouble speaking, mental/mood changes, difficulty urinating, signs of infection, or signs of liver problems. In the case of very serious side effects such as eye pain/swelling/redness, vision changes, or symptoms of a serious allergic reaction, it's important to seek medical help right away. And if you notice any other effects not listed above, it's important to contact your doctor or pharmacist. Chlordiazepoxide-Clidinium is a medication that has a risk for abuse and addiction, which can lead to overdose and death. It is important to take this medication exactly as prescribed by your doctor and to avoid taking it with alcohol or other drugs that can cause drowsiness or breathing problems. Your doctor will determine the smallest effective dose for you and the shortest possible time to take it. Suddenly stopping this medication can cause serious withdrawal symptoms, so your doctor may slowly lower your dose to prevent this. If you experience any withdrawal symptoms, such as headaches, trouble sleeping, restlessness, confusion, depression, nausea, or seizures, it is important to contact your doctor or pharmacist immediately. Before taking chlordiazepoxide-Clidinium, make sure to inform your doctor or pharmacist if you have any allergies or other medical conditions. This medication can cause dizziness, drowsiness, and blurred vision, so it's important to avoid driving or using heavy machinery until you know how it affects you. It's also important to avoid alcohol and marijuana while using this medication. Chlordiazepoxide-Clidinium may also make you more sensitive to heat, so it's important to stay cool and hydrated in hot weather. Additionally, older adults may experience more severe side effects, so they should use caution while taking this medication. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the risks and benefits of using chlordiazepoxide-Clidinium. This medication can also pass into breast milk, so it's important to consult your doctor before breastfeeding while using chlordiazepoxide-Clidinium. When taking chlordiazepoxide-Clidinium, it's important to be aware of potential interactions with other medications. Some products that may interact with this drug include potassium tablets/capsules, sodium oxybate, and drugs affected by slowed gut movement. Additionally, this medication may affect the absorption of other products such as certain azole antifungal drugs. If you are taking these medications, be sure to follow the timing guidelines provided by your doctor. Other medications can affect the removal of chlordiazepoxide from your body, potentially impacting how this drug works. It's also important to note that cigarette smoking can decrease blood levels of chlordiazepoxide, so be sure to inform your doctor if you smoke or have recently quit. Additionally, be cautious when taking this medication with other products that may cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Finally, it's important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness or a fast heartbeat. And be sure to inform your lab personnel and doctors that you are taking this medication, as it may interfere with certain lab tests. If you or someone you know has taken too much chlordiazepoxide-Clidinium and are experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, hot/dry skin, fever, severe dizziness, thirst, mental/mood changes, fast/irregular heartbeat, muscle weakness, paralysis, slowed breathing, fainting, and seizures. If you suspect an overdose, do not hesitate to seek help right away. Do not share this medication with others. Chlordiazepoxide-Clidinium is used to treat stomach and intestinal disorders such as irritable bowel syndrome, IBS. It helps to relieve stomach and intestinal cramping. This medication works by slowing down the natural movements of the gut and by relaxing the muscles in the stomach and intestines. It is best to take chlordiazepoxide-Clidinium on an empty stomach, usually 30 minutes before a meal, or as directed by your doctor. The dosage is based on your medical condition and response to treatment. Do not increase your dose or take it more often than prescribed. If this medication is used for a long time, lab and/or medical tests, such as blood counts, liver function, may be done while you are taking this medication. Keep all medical and lab appointments. Consult your doctor for more details. If you happen to forget a dose, take it as soon as you can. However, if it's almost time for your next dose, then just skip the missed dose and take your next one at the regular time. Do not take a double dose to make up for the missed one. It's important to store chlordiazepoxide-Clidinium at room temperature, away from light and moisture. Make sure to keep it out of the reach of children and pets. When you no longer need it or it's expired, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.